Okay. Good afternoon. My name is Ibrahim Khan, and I'll be discussing the influence competitive sports has on mental health. So, mental health is an essential aspect of life. It is a concept that is commonly overlooked by society and is not valued as much as physical health is in the 21st century. It affects an individual's way of thinking, how they feel in certain situations, and the way they behave. Unfortunately, due to society's lack of mental health literacy, it is likely that the younger generation are more likely to suffer from mental health issues. Therefore, it is important to identify mental health interventions among the younger gen to identify mental health interventions. A study conducted by the National Association of Mental Illness estimates that 1 in 5 adolescents will suffer from a mental disorder, and that half of adult disorders will emerge before the age of 14, 70% before the age of 18, and 75% by the age of 24. In addition, the study also discovered that 17% of high school students seriously consider suicide, and 50% of all lifetime cases will emerge by the age of 14. Therefore, it is important to search for effective mental health interventions. Fortunately, sports has a reputation for enhancing mental health, and its effects has been noted by the stimulus material named Psychological Benefits of Physical Exercise by Alicia Garcia, who discusses the relationship between sports, physical activity, and mental health, highlighting the advantages physical activity offers towards mental health. This leads me to my research question: to what extent does competitive sports influence mental health among youths ages 15 to 24? So the social stigma surrounded by mental illness has been prevalent throughout history and has continued to be a concern in our current society. A study conducted by the United Nations organization has questioned over 19,000 people in 16 countries. 39%, 39% believe that seeking help would mean losing friends, and 49% believe that seeking mental health resources would mean limited opportunities for them. People who are suffering from psychiatric illnesses have internalized the stigma, making them hesitant in seeking mental health treatment, which further intensifies the severity of their mental illness. There are many barriers that prevent people from accessing mental health resources. The diagram on the left pinpoints the barriers, such as denying the issue itself, fears as to what might happen, and lack of being aware of a mental health issue, along with the belief that mental health treatment may not be effective. So the adolescent period is a pivotal stage of life. It is the bridge between childhood and adulthood. This is the phase where teenagers are most vulnerable to mental health issues. The reason being, the reason being The reason being is the fact that the adolescent stage is where psychological changes occur at the highest level, making teenagers susceptible to developing mental health issues such as dissociative identity disorders, anxiety disorders, and eating disorders, and so on. The table on the left, the table, and so on. The table on the left provides the statistics of 18 year The table on the left provides the statistics of 18 years old who are struggling with a mental disorder. The statistic discovered that those who have been exposed to adverse childhood experiences are more likely to develop psychiatric disorders, reaffirming the idea that the adolescent period is a sensitive time, and any adverse experiences heightens the probability of developing a mental illness. In addition to adolescents, college-age students across North America have been experiencing a surge of psychiatric disorders. There are a great deal of university campuses who are struggling. There are a great deal of students at university campuses who are struggling with mental health issues such as depression, anxiety, and suicidal thoughts, and even psychosis. Contributing factors that lead to mental health issues among this population is extended technology use, academic-related stress, and financial strains that are responsible for triggering psychiatric issues. A study conducted by the National Alliance of Mental Illness surveyed 765 college students. The graph shown in front provides the results from the survey. The study found that 80% of college students feel overwhelmed by their responsibilities as a student. 50% have struggled from anxiety and as a result have struggled in school. 50% of students rated their mental health below average or poor. 30% of students reported that they had problems with schoolwork due to mental health issues, and 40% of students failed to seek help. A mere 7% of parents reported that their child suffers from mental health issues in college. Fortunately, there are methods available to prevent the emergence of mental health disorders. An effective way of addressing these concerns is by actively engaging in competitive sports. This idea was proven by the text Psychological Benefits of Physical Exercise by Alicia Garcia Figueres, who mentions, quote unquote, in relation to stress, it has shown plasma levels of corticosteroids may increase the likelihood of depression. Therefore, and logically, if a reduction of stress is happening via sports, then that might reduce the risk of depression. The graph shown in front describes the relationship between physical activity associated with sports and the mental health benefits. We can see that physical activity suppresses stress, which prevents the development of depression. However, if there is no physical activity or any buffer that protects against stress, then the possibility of depression escalates. Although sports participation is highly beneficial, there are a few shortcomings associated with this activity. By engaging in competitive sports, an individual is susceptible to suffer profound emotional exhaustion and depersonalization as a consequence of high burnout rates in respect to competitive sports, ultimately taking a toll on one's mental health. The graph shown in front describes the relationship between certain stressors associated with sports and the consequences it can have on mental health, such as mood disturbances, diminishing motivation, frustration over lack of results, dysfunctional behaviors, lack of control, and performance decrement. A big part of this has to do with the fact that youths participate in competitive sports because they feel it is a requirement rather than it being a personal choice. The probability of experiencing burnout or emotional exhaustion ultimately depends on the type of motivation. Those who experience burnout are typically motivated extrinsically rather than intrinsically. Other factors play a role in affecting mental health, such as strained anxiety, lack of coping skills, low autonomy, low social support, and goal orientation. This can lead to complete social withdrawal, impaired immune function, chronic inflammation, and long-term performance impairment. However, such circumstances only occur among those who participate in sports for various reasons besides it being a personal choice. Those who participate in sports for personal enjoyment are more likely to experience an improved mental state. By being physically active, it protects against mental health problems. It decreases depressions in older adults and among youths. It also reduces the symptoms of postnatal depressions. It is also effective as medication for mild to moderate anxiety and depression. It also improves self-esteem and cognitive function in youths. Playing sports reduces psychological distress by 34%, by 34% are for those who participate in sports 1 to 3 times a week, and 47% for those who participate in sports 4 times a week. So, in conclusion, people who participate in sports clubs and organize recreational activity typically enjoy better mental health. What are your questions?
Okay, I have 2 questions for you. First up, did your research go in a different direction than you originally had planned it was going to go?
Yes. At first, I was doing research on what the benefits sports participation offers, but then I also discovered that as many benefits it has, there are also some negative effects of it, such as emotional exhaustion. I didn't expect that my research would actually counter the positive influences sports offers.
Okay, and there we go. If you had more time, what additional research would you have conducted?
I will look more into emotional exhaustion and what other negative effects it can have on athletes, and what type of and how emotional exhaustion can actually lead to mental health issues. Like at first, I was thinking that sports would decrease the probability of mental health issues, but if someone is more active in competing in sports, then there's also a chance that it can lead to mental health issues as well.